Hi, I'm David Ridley. My guest is Dr. Kelvin Baggett. Dr. Baggett holds degrees from Duke, UNC, ECU, Johns Hopkins, and he completed his medical residency at Yale. I met Kelvin when he was an MBA student here at Duke, and I could tell he was bound for greatness. In many ways, he reminds me of my colleague, Dr. Mark McClellan, in that he's had a really rich career in healthcare. He's done so much, and yet he's very young. And by the way, I just heard a beeping sound. I think I may be beeped on my definition of young, because I define young as people under the age of 55, which Kelvin and I both are. Despite being so young, he's done so much. He's been a hospital executive, a healthcare banker, a drug wholesaler, a public servant. Welcome, Kelvin.
David, thank you very much for your warm welcome. It's always good to be able to return home to Fuqua and Duke, be it in person or virtually. And I must say is that you mentioned many of the things that I've been able to do, and I would attribute much of that professional success to what I learned at Fuqua. So I'm always eager to engage in these kind of conversations and give back as I can.
Thank you, Kelvin. You've given back so much to us. You've done a great deal in service for Fuqua. You've given us much more than we've given you, and we're grateful.
Thank you. Thank you.
So, Kelvin, you've been an investor in healthcare startups. What advice do you have for healthcare entrepreneurs?
Yeah, so what I would say is, one, be very clear that you are committed and you have a high degree of conviction to whatever startup or endeavor you're going to undertake, because it is not at all easy. As I was told very early on, as hard as you think it is, just know that it's hard. And as difficult and lonely as you think it may be, it's going to be even more. So you certainly have to have a tenacity and a perseverance, and that comes with this is the problem that we really think we need to solve, or this is the opportunity that we really need to pursue. And in the absence of doing that, in some way, the world is going to be underserved, or the need is going to be unmet, or whatever that's going to be. You have to come with that. The other thing is to recognize that everything takes partnership and relationship. And I mean everything. I mean, these solo entrepreneurs still have to create a sense of community on multiple levels. One, you have other entrepreneurs who maybe have gone ahead of you, may have had some success, or maybe at the same level, so that you have a community to dialogue with. And that also extends to having a community of those who are invested, not just financially, but also emotionally in what you're doing, so that can provide that additional level of support. So you have to you have to recognize that you want to create a good community and a partnership. So, first commitment and conviction, then you want to have community and partnership. And then I'd say in that, be selective in terms of who you entertain. And I'd go to this as a capital source, which is there are a lot of different sources of capital, but what you'll find is teasing out who really buys into what you're doing, who may have had some previous success and a strong expressed interest in that. Those are the kind of people that you want to align yourself with. Now, having said all that, I have high admiration for entrepreneurs. I continue to encourage people who have a desire to do it and really can convey a strong sense of connectedness to it, to pursue it, because that's the only way that we truly innovate and create meaningful change, is for people to either express that outside of an institution or to bring that into an institution and have that kind of entrepreneurship, but a similar spirit, but just using a different balance sheet.
Great points, Kelvin. Commitment and partners. And among those partners, your investors, choose them wisely. Mm-hmm. You were called on by your mayor to help with the coronavirus epidemic. Mm-hmm. What advice do you have for expanding access to COVID vaccines, and including people who are hesitant to get the vaccine?
Yeah, I would say that one is, it was a great honor to serve the city of Dallas in that way. So we're large, we're geographically dispersed. If you look at the spread and sprawl that we have here, and we're also demographically diverse. right? So there were so many things. And to be able to combine a lot of my experiences and really contribute at a very critical time, not just for the city, but for the implications for our nation and the world. And I'll go that far because we're all working through, learning through, living through, at times struggling through this COVID-19 pandemic together. What I learned is never underestimate levels of complexity that you're going to have to negotiate and navigate through. So there's a lot of bureaucracy that exists in the world, and certainly when you're coming into a civic servant role in that capacity. But so never underestimate that. Two is also make sure that you bring people into the conversation as early on as possible, right? And by that I mean there were some things that were being done that may not have had the level of input at the grassroots level, and we identified that and we said, well, if these are the individuals that we're looking to help or influence or support, we need to figure out a way to create dialogue either directly with them or through what we decided were trusted sources, other leaders in their community who they already had a previous relationship with. The third thing is I'll say is never underestimate the overall degree of difficulty of getting anything done. So this pandemic has proven at multiple levels just how difficult it can be to execute on things. The science has evolved, how we test, how we treat, even the things, if you go back early on, what are some of the steps that we should take individually to prevent it? I can recall a time my wife and I were washing down everything, and our grocery bag had to sit outside for a while. And, we had these things. And so what there has to be is a recognition is this is going to be hard, right? Right up front. This is going to be hard. What I'd say now is I feel really good about where we are. Really good. The pace of development of these vaccines, Operation Warp Speed, has been incredible, right? The scientific discovery, the ability to commercialize this has truly been unprecedented, to do that in about 9 months. What I think has been missed is a higher level of communication beyond the speed that these drugs, these vaccines were developed. It goes to why they're safe, what we really mean when we say they're effective, who they were tested on, who participated in the trials, what they prevented as a top level kind of outcome, right? Morbidity and mortality, hospitalizations, those things, right? And so that's gotten overshadowed by a lot of things, and I think at times undercommunicated. What I'd say to people is that based upon the CDC guidance, based upon what's publicly available, we have every reason to believe that these vaccines are safe and effective for those populations in which they've already been tested. And so with that, we know in the absence of these vaccines that there is a higher likelihood that you could get sick, hospitalized, and potentially die. And I saw that in my previous roles across various demographics. So I say we celebrate the fact that we were able to achieve these things scientifically. We commit to getting ourselves vaccinated when it is time, when it is available to us, when we are eligible, based upon the publicly available data, again, that supports us moving in that direction. And that we also commit to sharing that experience with others. So encouraging others who may be a little bit more hesitant, who may lack information, and who might otherwise be better informed about it.
Great points about celebrating the scientific success, but also about ensuring that we have dialogue and involve people at the grassroots level.
Thank you.
What advice do you have for leaders, healthcare leaders, or leaders more broadly, who are brown or Black?
Well, I'd say that, that question, as I reflect on that, I could go a lot of different ways. So I'll start with healthcare leaders in general. Healthcare is a beautiful industry in which to devote your expertise, your energy, your time, and also a place where you can make such a significant change and difference, right? It has those things, right? It can challenge you in ways. It allows you to think about things from a variety of angles, and really make a meaningful difference. And at the end of the day, go home and say, I know I impacted somebody's life. And what I used to say was, I'd say the beautiful thing is when you impact people's lives and they don't even know you did it. Right? When you're extending yourself to others and they don't even know. So I'd start there. It's an incredible field, and I think the opportunity continues to grow. If you look at the level of acceleration of digital therapeutics and the adoptions of these other technologies that's taking place around the pandemic, those were things that were pulled forward years. And we got through regulatory reimbursement and acceptance of that by people in the public. So things that we thought were hurdles that were going to be more difficult to climb, we got through it very quickly. So that should speak to the level of innovation that can be supported in the industry. And it should also inspire all of us to continue to push towards innovation and expansion of more high quality, affordable, accessible care for everybody, which is what drives me. In terms of Black and brown, what I'd say is come into any organization as a leader, as an individual, and don't limit yourself to your phenotype. So you are more than what you look like or what people see. All right. You've obviously gotten there because you're capable, that you actually have the capabilities that will actually continue to extend themselves. So not just what you've demonstrated, but growth people see in you. Your ability, if you're a leader, to actually involve people in goals that are meaningful to organizations and to advance those forward, and to deal with difficult and challenging conversations and situations and decisions. Like, that's why you're there. That's what a leader does. And so I'd say bring all that, as well as where you're from, what you like. Part of this is making sure that you don't get defined and limited. And the way that you do that is to remind yourself and to share with others this multifaceted person who just happens to be Black and brown. Then I just say, from a technical perspective, seek out mentors, sponsors. I've got groups of mentors and sponsors, some who've been with me the entire time I've been in the professional space, either practicing or now in the private sector. They've been with me. Others who have entered and exited, and they're incredibly diverse. And so there is benefit to actually having a diverse board of advisors who can help you to think through, navigate, and negotiate this leadership trek. The thing I will also say is leadership can be very lonely. And it can be lonely whether you're Black, brown, white, it does not matter. There is a loneliness that can come with it. And so with that, I think that it's incredibly important that you do create a sense of community so that you can have some support. Kind of as we talked about with entrepreneurs, it's also important as a healthcare leader, certainly important as a Black and brown leader, that you try to create a community for yourself.
Great advice for leaders about that advisory board, those mentors. And I agree with you. Healthcare is an amazing field to work in.
Yeah, it is.
You currently work for a drug wholesaler. What do drug wholesalers do? Do they add any value?
I'd say absolutely yes. Unequivocally, yes. and we do. All right. So when you think about the supply chain, if you look at what we're doing as McKesson, as one of the largest pharmaceutical and wholesale medical supply distributors, that we are remaining informed of the science, that we have these deep relationships, that we're working to make sure that we're able to procure necessary drugs and other medical and surgical supplies and reliably deliver them to the points where they're necessary to treat, care for, and manage patients. And so, yes, we add tremendous value there. I would say I'll add some additional elements to it, because I know you asked about distributors, but one of the other things about McKesson is that while that is our history and we're 188 years old, I mean, it's amazing that you have a company in the Fortune 10, 188 years of age, that continues to evolve and be relevant. And I'll speak to that evolution. At the core, we are a wholesale distributor, but also we moved into being a technology company, a data insights company. We're also have as part of McKesson, the U.S. Oncology Network, which is the largest provider of ambulatory care for cancer patients in the country. And so we have those elements. What we do, obviously, to support pharmacies, retailers, and others goes back to the distribution business. But what I'd say is there is a level of diversification, like many of these other businesses, that also has to be appreciated. And while at our core, the distribution business does create value and is necessary, we also have these other elements that are also critically important to the health and well-being of many communities throughout the nation and for us throughout the world.
The next segment is overrated or underrated. It's a segment I stole from Tyler Cowen. I'll name an item and you'll say whether it's overrated or underrated, and you can pass. For-profit hospitals, overrated or underrated?
Oh, I'd say that since we're going to talk a general term, I'd say they're underrated. Yeah, I think underrated in the sense that the necessary care, the benefits they bring to communities and as an employer often are missed because other things get highlighted.
How are for-profit hospitals differ from not-for-profits, if at all?
Tax status, right? So tax status. So that's really the fundamental difference. Both are there to provide valuable services, but there are obviously some tax benefits that come to the not-for-profits that don't benefit those who are tax paying.
Overrated or underrated? Texas barbecue.
Whoa, okay. I'd say from a North Carolinian's perspective, grossly overrated.
That's what I was hoping you'd say, my friend. I knew as a North Carolinian, I knew I could trust you to give the correct answer there.
Thank you. That's easy.
For the uninitiated, can you describe the difference between them?
Yes. So what I'll tell you simply, the way I tell people at times is in North Carolina, barbecue is a noun. In Texas, it's a verb. In North Carolina, when somebody says, would you like to go out for barbecue? You know you're having pulled pork. All right. Now, the East Coast, West Coast will differ if it's going to be tomato or vinegar based. In Texas, if somebody asks you to come over for a barbecue, you have to ask them, what are we barbecuing? Usually the core is brisket, but it could be a multitude of things. I like the simplicity of North Carolina. I also like the taste.
That was fabulous. Noun or verb? That was fabulous. Okay. More broadly than Texas barbecue, the state of Texas, overrated or underrated?
Wow. There I'd say that it depends. Are you talking to somebody who's a native Texan or somebody outside the state? So it could go either way. If you're inside the state, you probably have an overrated view of Texas. If you're outside, you may underrate some of the things that Texas has done for the nation and the contribution. So I'd say it depends on who you're talking to. The problem is you're talking to somebody who has now made Texas his home for almost 11 years, but is still at his heart a North Carolinian. So I'll just leave that to you.
This has been fabulous. So fun to get to talk to you. My guest today has been Dr. Kelvin Baggett. Thank you, Kelvin.
Thank you, David. It's been a privilege.